everyone, and thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I am Kathy Riley, the Associate Director of Programs at CSCLA, and I'm really honored to welcome you to this week's webinar. And the title of the webinar is The Bridge Between Eastern and Western Medicine for Optimal Oncological Care. And before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization that provides vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. And our programs include support groups, healthy lifestyle classes, social activities, and educational programs like the one you're attending today. And we'll provide information about our programs and services at the conclusion of the webinar. If you would like to learn more, though, about services or watch past webinars, you can visit our website at cancersupportla.org, and we'll be putting that link into the chat. And before I introduce today's speaker, note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into that Q&A feature found at the bottom of the Zoom window at any time. And we may not be able to get to all of your questions today, but we'll get to as many as possible. And now I'd like to introduce our speaker. Dr. Lucy Postolov was born in the former Soviet Union and received her medical degree with a specialty in neurology. In 1995, Lucy obtained her master's degree in acupuncture from Emperor's College in Los Angeles, and in 2019, her doctoral degree from Pacific College of Chinese Medicine. She has been practicing medicine for the last 35 years and is the first acupuncturist to receive treating privileges at Cedars-Sinai Medical Center over 20 years ago. Dr. Lucy was awarded by the Los Angeles Business Journal in 2015 as one of the women who make a difference, and awarded the Woman of Action by the Israel Cancer Research Fund in 1988. And for many years, Lucy was on the professional advisory board of Cancer Support Community Los Angeles. She worked as the first acupuncturist at the Cedars-Sinai Integrative Medicine Medical Group from 1998 to 2002, bringing integrative medicine to a major hospital in Los Angeles and training fellow interns. And Dr. Lucy, it gives me great privilege to introduce you and welcome you to today's webinar. So thank you so much.
Thank you so much, Kathy, and everybody who is joining our seminar today. And today we're going to talk about how integrative and complementary and alternative medicine could help you on your path. Now, sorry, I have to change the slide. And okay. All right, perfect. So basically, this is the 10 chapters which are in that program. And before I'm gonna start talking, I want to make a disclaimer. Normally, before we start any presentation, we're saying that we're not affiliated with any pharmacological group and that we are not selling everything. I have to say that I am personally very much involved in this subject. All my heart, all my soul is with you. So I have to do that disclaimer. And the reason for that is the following. When I went to medical school, to be honest with you, I did not plan to become oncologist. It never even crossed my mind. I always was fascinated with the work of central nervous system, the function of the brain, and spinal and peripheral nervous system. But as fate had it, 30 years ago, my mom was diagnosed with stage 4 breast cancer. She came from former Soviet Union 2 years after we arrived here with my husband and daughter. And I just realized that I have to do everything in my power. And by then I already was practicing acupuncturist and had my private practice to do everything to help my mom in her journey. And after the surgery, when the doctor removed her breast and found there 27 lymph nodes, he said that she will not live for longer than half a year. My mom lived 4.5 years. She went in complete remission. She traveled the world. And yes, her path was difficult, but Chinese medicine and acupuncture and Chinese herbs helped her tremendously. Cancer runs in my family. My grandmother passed away from breast cancer when my mom was 3 months old, and grandma was 35 years old. And if it would be not enough, 12 years ago, I lost my husband of 33 years from unknown primary cancer. And it was my very personal journey to help patients, and still is, with cancer, and to be on their path, to help them, to educate them, to work with them. So today, the National Institute of Health divides all integrative and alternative medicine into 5 major domains. And we divide the whole medicine right now in 2 major categories. It is mainstream medicine and complementary and alternative medicine. Well, you're all familiar with mainstream medicine. It is your oncologist, it's your surgeon, it's chemotherapy, it's radiation, it's immunotherapy, and so many other Western medical modalities. But let's remember that Western medicine is only about 150 years old when we start discovering antibiotics and anti-inflammatory. But from the beginning of times, in all different countries, start from Egypt and China and Japan and Korea and Europe, we knew only complementary and alternative medicine. Now, I have to say that if anybody will tell you that you do not need Western medicine and that you can fight cancer only with complementary and alternative medicine, please run away from that person. Because in the last 30 years, fighting with my patients with cancer, I can tell you, there is no one modality in complementary and alternative medicine which will save a patient from cancer. I want to give you an example here. Many years ago, I had a gentleman who came here with stage 2A colon cancer. And he said, I don't want chemo. Chemo is toxic. I don't want surgery. I don't want Western doctors. I just want you to treat me with herbs and acupuncture. And my answer was, unfortunately, I cannot do it. You need to have a team. And I spent so much time explaining to him and his wife why it is important to have a good team. And I said, you need a surgery, you need chemo, you need this and that. And I gave him a list of doctors who I referred to. He got so angry with me. His wife wrote me the most nasty letter. And I said, I'm just refusing to treat you unless you're going to have a Western team. Half a year later, he came to me and he already was in stage 3B. And it was completely different picture. And unfortunately, we were not able to save that patient. And that's why I'm telling you, please remember, you cannot use only integrative medicine. You need a team. Now, again, this is the slide which shows how National Institute of Health divides all integrative and alternative medicine. So you see there are 5 major domains here. And I'm going to cover today most of it. So in biologically based approach, we're going to talk about diet, herbs, and vitamins. Energy, we're going to talk about Reiki medicine, magnets, Qigong. In alternative medicine, we're going to talk about Ayurveda, homeopathy, naturopathy. In mind-body intervention, about yoga, spirituality, relaxation. And in manipulative and body-based therapies, we're going to talk about massage, chiropractor medicine, and osteopathy. So what is Ayurvedic medicine? Ayurvedic medicine basically is very old, about 3,000 years old, Indian medicine. And they divide all constitutions of the body into 4 major domains, and they treat accordingly. In a way, it is similar to Chinese medicine. A lot of herbs we're using overlapping. However, in Chinese medicine, we are believing that there are 5 different areas. We call it fire, earth, metal, water, wood. And we believe that human body is in balance where yin and yang are in balance. Homeopathy is coming from Germany, from Europe. In United States, as of now, we do not have certified homeopathy schools. We do have a lot of colleges of Chinese medicine. It is right now considered to be a primary care health, covered by most insurances. Some Medicare programs also cover it. With homeopathy, we treat like with something like. So if you have cold, you will have some kind of medicine which will add a little bit of cold to your system. This is opposite of what we do with Chinese medicine, because if you have a cold, we will prescribe you probably chicken soup and hot tea with honey. So although both of these systems are very powerful and legitimate, you can see that you cannot use in the same time Chinese medicine and homeopathy because the philosophy of it is very different. Now we have a lot of naturopaths in United States, and they graduated from special schools, and they're licensed as well. Now let's start with mind-body intervention. I have to say that I am a huge supporter and believer in the power of mind to heal. I'm going to give you an example. I had 2 patients in the same time. That doesn't happen very often, but sometimes God sends you kind of similar patients. So it was 2 female patients. Both of them had colon cancer. They were the same age. They had exactly the same pathology of the cancer. More so, they had the surgery by the same doctor. And they also had chemotherapy and radiation done by the same medical group. One of them was always complaining and look, I'm not saying that patients should not complain. Obviously, when patients come to me and they say, oh, I complain a lot, I said, you should complain. You came to me. So if I don't know your complaints, how I will address your issues. But this one was complaining about life, although she was a trust fund child. She never worked. She was studying psychology. But she had an incredibly negative attitude. Another woman with exactly the same situation. She lost her mother and sister. She was divorced recently with her husband, but she was so positive. She said, I'm gonna beat it, I'm gonna survive, I'm gonna do everything in my power. Why do I give you these two cases? Because one patient, and now she is dead already probably for 17 years. Another one alive, she's an actress, she is quite successful, beautiful, and lives a wonderful lifestyle. So the difference between these two patients was only in their attitude and their mind. So mind is very important, and we say we are what we believe. So if you strongly believe that you will survive, the chance of your survival is much, much higher. So meditation. I do meditations for at least last 30 years. A long time ago, before we had all these wonderful apps, I produced a meditation for cancer patients. It was very old-fashioned on CD. We don't have CDs even anymore. And there are two favorite apps which I personally recommend. One is Headspace. But my favorite is Insight Timers. Why do I like Insight Timers? Because they ask you their specific questions, and based on who you are, they will kind of specifically prepare meditation for your issue. So if you have insomnia, they're going to give you insomnia. If you have depression, for depression. Did you have a good day today? Why did you have a good day? So they're very customized for each person. Hypnosis, also very powerful treatment. I had a patient who had a lung cancer, and he definitely had problems with breathing, but his fear of suffocating was so strong that I felt that unless he's gonna have that hypnotherapy, he will not stop feeling suffocating, because he was not in his final stage. He was in the very beginning. I love yoga, absolutely. However, when you go to a yoga studio, make sure that the yoga master is at least 3 to 7 years trained in India, and not just for 3 weeks or 3 months in United States. Because yoga is not just about being a pretzel. Yoga is about breathing. Breathing is so important. Guided imagery, again, if you have positive affirmations, positive energy, positive visions, the success rate of your survival will be much higher. I do believe that practicing arts, like there is special art therapy, music, dancing, it's all positive, because it's all helps you to release endorphins. Biologically based approach is about vitamins, herbs, food, and special diet. Vitamins sometimes will be prohibited during your chemo. A lot of doctors will not want you to take vitamins because they are antioxidants. Same comes with the radiation. A lot of doctors will not want you to take any vitamins. However, there are a lot of vitamins which I still recommend you to take, and there are a whole chapter about it later. Herbs and herb-drug interaction is very controversial. A lot of medical doctors will not want you to do it. I personally a big fan of Chinese herbs. I'm using specific formula called chemo support. and formula radio support. And for those oncologists who will say, no, I don't want patient to use any herbs, I offer to my patients, and that's going to be in your slides further, the whole list of research on every single herb and herb-drug interaction showing that Chinese herbs are not in conflict with Western chemotherapy or drugs. Now, food and special diet is so essential. What we eat right now is honestly quite scary. Just a few months ago, a huge article, it was a coherent study, came from London, from England. And you know, food in Europe, it doesn't have pesticides, there is no GMO, so their food is much healthier. I'm sure when you travel, you notice that tomato actually tastes like tomato and strawberry tastes like strawberry and not like some plastic. So it is essential to all cancer patients. So in that study, they found that 95% of cancer patients are related to food. And that's like kind of scary, because if that is statistics from Europe, I don't want even to think about what are statistics in the United States, because we know that most food have pesticides. And I'm gonna talk about diet later on. I'm trying to speed up because I don't have that much time. So about manipulative and body-based therapies, massage I like, but only if you do not have spreads in your lymph nodes, because if you do, massage can spread it. Chiropractic care will be helpful for adjustment of the spine. Usually doesn't do much for cancer itself. Reflexology is basically the same as acupressure, except it's usually done on your feet and on your hands. Now, there is a new type of treatment which is very popular in Europe. In the United States, we just in the beginner. I do offer it in my office. It's called lymphatic drainage. In United States, we're studying the English School of Medicine, while in Germany, Switzerland, Austria, it's a completely different school of medicine, it's German, and they do a lot of lymphatic drainage. However, again, if cancer is in lymph nodes, I do not recommend it. Tai Chi, Reiki, Qigong is incredible, because I do not recommend my patients normally to have a very intense workups like aerobics and like very intense running or very heavy weightlifting during the treatment. You can do it later on. But Tai Chi, Qigong, Reiki is a very kind of slow movements, and that creates the balance in your system. A lot of people ask if acupuncture is real and if it's just booga medicine. First of all, to be acupuncturist, you have to have at least 4 years of college, and if you want to get doctoral degree, it's another 2-3 years in another school. And they did a lot of clinical trials with functional MRIs, and they showed that when we put the needle in the patient, the reaction from the skin goes to your spinal cord, and then it goes to thalamus and hypothalamus, and after it responds to that part of the body which we want to affect. Why acupuncture has such a profound pain-killing effect, and why so many patients after acupuncture ask me, can I get addicted to it? The reason is the following. when we do acupuncture, we stimulate human body to release our own neurotransmitters. And you know that endorphins are released when we have fun, when we exercise, when we make love and have an orgasm, when we have chocolate. So it is basically natural, kind of like morphine, not as strong, but powerful enough to help you with the pain. Norepinephrine and dopamine are also very important neurotransmitters. When you cuddle with your child, with your grandchild, with your husband, you have that dopamine response. And again, during acupuncture session, that's what is released, and that's why acupuncture is so helpful for patients who are fighting cancer, if they're depressed, if they're in pain, and etc. So how can we manage pre-op symptoms? Usually before the surgery, people have anxiety. The whole central nervous system goes completely out of balance. And usually you have to prepare GI because during the surgery you have a lot of painkillers, and after surgery, and it creates constipation. So making sure that GI is working is very important. Now, to calm anxiety, I'm going to show you just few points which are very easy. On your hand, if you're gonna make a fist like that, where your pinky hits, that is one of the most powerful point to calm your anxiety. I love that point. Absolutely love that. When I was taking my medical board exams, I was pressing that point for 8 hours. I ended up having a bruise there, but I didn't have anxiety. And another point is actually next to your nail. You can pinch that point and also calm your spirit. To help GI, there's a special massage, Japanese abdominal massage, which hopefully we'll have time to talk about too. After the surgery, working for 20 years in Cedars, I very often would go to post-op to help patients. Again, patient wakes up feeling anxious, although they're drugged, but they're concerned about their future, about biopsy reports, and etc. So again, working with anxiety, massaging those points is very helpful. To prevent nausea and vomiting, there's another great point you can massage yourself. It's called pericardium 6. If you're going to put 4 fingers below your wrist, right between these 2 tendons, it feels like guitar string, and press that point. It's a great point for nausea and vomiting, for cancer patients, during chemotherapy, post-surgery, for pregnancy, motion sickness. Pain control, again, like I said, if you do acupuncture at that stage, you don't need to take so many painkillers. In order to invigorate the function of GI, you can use massage, but also I recommend to buy aloe vera juice, which has laxative effect, very gentle laxative effect, and that will help with constipation, because most patients have a lot of constipation after surgery as a result of painkillers. Now, a lot of patients will have urine stagnation, kind of accumulation in the urinary bladder. And again, until the bladder and intestines start working, you will not be released from the hospital. About 10 months ago, I had a surgery of full knee replacement therapy, not fun. And the doctors would not, because I wanted to get out of the hospital the same day, the doctors told me, well, until your bladder will empty, we will not let you go. And I was so like eager to get out of the hospital. So they did ultrasound and it was too much still in the bladder. And I said, okay. So I asked my daughter and my husband who was next to me. I showed them the points on my legs and I start massaging myself, Sanjiao 5. So again, 4 fingers on this part of the hand. And within literally half an hour, the bladder was empty. And the doctor told me, how did you do that? It usually doesn't happen like that. I said, I have my tricks. But literally, my husband, my daughter, and myself were very vigorously pressing those points. There are a lot of very unpleasant symptoms which come with chemotherapy. I don't know what kind of audience I have today. That's why I prefer to have live audience so I can ask patients what stage of cancer you are or in which part of cancer you are, treatment. So I just gonna try to cover as much as I can. So during chemotherapy, we have to deal with nausea and vomiting. I already explained what to do about it, diarrhea and constipation. There are 4 points, like if you take 2 fingers from your belly button and press those 4 points, it also helps with both constipation and diarrhea. For insomnia, we have fantastic Chinese herbs. I'm also a big fan of CBD. You can use CBD. Fatigue is normal during chemotherapy. I want you to remember that feeling tired is okay. I remember one of my patients once told me, I spent yesterday the whole day in bed, but I'm doing chemotherapy, so it's okay, right? I said, look, you don't have to have an excuse to spend the whole day in bed. If you're tired, please spend the day in bed. I like Louise Hay when she was asked how she looked so great at the age of 80. She said, because every week I spend 1 day in bed. And she reads, she listens to the music, she does some work, but she spends it in bed. So if you're tired, don't push yourself to work out. Don't push yourself to go cook for your family if you have that luxury and you have somebody to help you. I usually recommend my patients to prepare their meals prior to the treatment. Feeling loss of control is so difficult. A lot of patients complain about it. I see how little time I have and how much I have to cover it. It makes me very anxious. So you will very often have suppression of leukocytes and erythrocytes. There are special drugs doctors now give you, and that creates pain in the bones, and they recommend you to take antihistamines. But again, there are specific points we can needle, and there are specific herbs we can give you to help you with that issue. I talked about pain. Now, premature menopause is super important. I have the whole chapter going later on about it, but let me just cover it right now because there are a lot of women who will experience hot flashes, night sweats after chemotherapy because if you're estrogen or progesterone positive, they're gonna do everything to suppress the function of your ovaries. Or if it's cancer related to uterus or ovaries, they will remove those organs, and again, that will create all those symptoms. There are fantastic formulas for that, Chinese Ayurvedic formulas. There are special points. Now, you may ask your OB also, because a lot of women, after getting into menopause, will experience vaginal dryness, will experience incredible pain during intercourse, and sometimes there is incontinence related to that. So there are procedures like Mona Lisa, which help with vaginal dryness. It's basically laser therapy. There are 3 sessions, 6 weeks apart. There are wonderful lubricants. I like the company called Foria. It is CBD without any THC, and they have special vaginal insertions and special sex oils, which help sex to be completely not painful, because one of my patients described intercourse after being married for so many years. She said it feels like 100 blades went through my vagina. So you need to bring back elasticity in your vaginal walls and in your lips, and that is very helpful. Hormonal balance, very often, like woman or man after prostate surgery will not be able to take hormones. So again, acupuncture will help with side effects. Radiation will cause very often redness of the skin, and I like aloe vera for that. There are other treatments like immunotherapy and stem cells, and usually we cannot do anything in that case because stem cells patient will be isolated for 4 weeks. Immunotherapy, we do help a lot. So I talked about menopause and chemotherapy, post-op pain. Neuropathy is very important because so many patients will have neuropathy after chemotherapy and during chemotherapy. So it's very important to start treatment right away. Chinese medicine, massage will help, but incredibly helpful is infrared light lamps. They're not expensive. You can buy them on Amazon, and doing every day 30 minutes on your hands, if you have neuropathy in your hands or your feet, shows incredibly helpful results. Okay, I'm gonna skip the whole reproductive oncology because if we have younger patients, you're gonna see my other presentation, which is 3.5 hours, and I'm talking about preserving semen and ovary tissue there. Food as a medicine is super important, and I usually give my patients exact regimen, what to take before surgery, what to take after surgery. I was shocked. I told my patient she was a single woman preparing for the surgery, and when I told her that you have to cook yourself chicken soup, so when you come after surgery, you have something very nutritious to eat. And what I discovered that she actually didn't know how to make chicken soup. And I'm telling you, it is the most simple and delicious food, and a lot of Chinese families will make you a very special soup. I once watched a woman in Whole Foods, and she was picking only legs and wings and bones from the chicken. And I knew exactly what she was doing. She was preparing the food for somebody who were in a surgery. Why? Because we need bone marrow. That's why we're not doing just white meat, which is healthy for other reasons. But for cancer patients, I like all soups with bones. So if it's a fish soup, I usually cook fish, like small fish, then I throw away all the fish, and then I put another more fancy fish and put a lot of vegetables there and spices. Rachel Geller has a special line of spices for cancer patients, and she also have a fantastic book on nutrition and cancer patients. I recommend you to get her books. I am totally against goat milk, against cow milk, because cow milk creates mucus in your system. I recommend goat milk and in cheese form and milk form and etc. Okay. So another favorite tip for me is green tea. One of my masters, I was very lucky. I was trained by best masters of Chinese medicine like Hiko Matsumoto, Mikishima, Alex Tiberi, now later Alex Tiberi, like Giovanni Michiocia. And for example, Dr. Mikishima, he was signing contract with his cancer patients to have 6 cups of green tea a day. I don't do that. I feel it's a little bit too much, but I strongly recommend my patients to have at least 4 cups. If you cannot have caffeine for some reason, what you do, you put a bag of tea in your cup just for 1 minute, you remove it and you throw away the first cup because all caffeine will stay here. And then you take the same bag and put it in another cup, and that tea, which will be decaffeinated. Why we recommend dandelion and chrysanthemum flower tea? Because it is very cooling. So if patients very often have ulcers in the mouth, that will be a great tea to have. Seaweed is fantastic because seaweed breaks any stagnation, and you can buy it in Japanese store, in Chinese store, you can make it yourself. Mushrooms, there are so many wonderful properties of mushrooms. I usually sell my patients special immune strengthening mushroom combination of 5 most powerful mushrooms. So if you cannot cook it, at least have mushroom as a supplement. For constipation, aloe vera, beets, plums, ginger tea. For nausea, lemon juice and ginger tea. For ulcer in the mouth, bitter melon and watermelon, but try to have just the white part of it, the rind, and that's perfect for the ulcers in the mouth. Basically, this is a list of foods to have after and during radiation, and my strong recommendation, everything should be organic. If you cannot afford organic, soak your fruits and vegetables at least for 10 minutes in salt and few drops of peroxide, and then wash it very well. And that will remove the pesticides which on the top. I highly recommend you to grow your own vegetables. If you don't have a garden, there are a wonderful vertical gardens you can put even on your balcony. I personally do it. We don't have much land next to our house, but I grow my own fruits and vegetables. I still have tomatoes and I have still figs from my garden. Fish, definitely small size, because big size of the fish will accumulate mercury, preferably wild, because even in the best farm, fish usually is not as healthy. Chicken, again, free range, hormone and antibiotic free. We have a huge epidemic right now with people being fed through the food, meat, chicken with hormones, because they do a lot of hormone stimulation. So the cow or the chicken grows bigger. More so, we're drinking water, and when woman is taking hormone replacement therapy, or if woman is taking the birth controls, she urinates the hormones in the water. And the way it works, the water which goes from our toilet goes to special reservoirs, and they kill their bacteria and filters, but they not clean the water from the hormones. And that's why be careful what you drink. I prefer, although there are a lot of controversy about it, the alkaline water. CBD, there's a big hype about CBDs right now. And I personally started studying CBDs for one reason. My patients started asking me about it, and I didn't have good knowledge about it. So I went and attended many seminars and many lectures and all continuing educations to learn about CBD. CBD are very helpful. Unfortunately, in the United States, it is not legal on a federal level, but every state of United States makes it legal in this country, at least on the level of the state. CBD is better to use without THC, or THC, which has less than 0.3, unless you're in excruciating pain, and then you need CBD with THC. I will not have time to describe how this works. I told you about legality of it. If you travel the world, check. Some Canada does not have restriction. Europe has restriction where it should be no more than 0.2, 0.3 CBD. So check the law before you travel if you take it. Now, there are not enough clinical trials in United States because it's still on federal level, not legal, but from Canada and from Israel and from Italy, if you're gonna do search, you're gonna see thousands of clinical trials because it is legal there for the last 30 years. Now, psychedelic mushrooms are still not legal, except for a few states, Colorado and Oregon. Dr. Andrew Weil said that psychedelics are one of the most powerful tools for making use of the mind-body connection to promote healing. I took some courses on psychedelics, and in those places where it's legal, it has to be done supervised. There are 5 sessions with psychologists, and there is a session when they give a patient CBD, psychedelic, in a very small portion, and basically psychologist is sitting with a patient for 8 hours and goes with him through all his experiences. I would not recommend doing it on its own. Herb-drug interaction, again, if you need to tell your doctor that there is no interaction between Chinese herbs and chemotherapy, refer them to this slide. There are like 40 40 pages of it. Okay, menopause, I did talk about it. I want to say that erectile dysfunctions after many surgeries for men are very sensitive to men, because men, when they cannot perform, feel horrible about it, libido changes, and etc. So we need to work on that. And finally, I want to say that there are 6 best doctors, and it is sunshine, that's your vitamin D, it's your clean water, I talked about it, rest, quality of air, go to the places with parks and ocean. Exercises are super important, but again, I recommend slow exercises, and I did talk about diet. And this is Phi Tibetan rites or jewels. That is the exercise I also recommend for my patients. Thank you so much. I am ready to do questions, and I know I'm running late.
You you are fine. Well, what an informative presentation. Thank you for covering such a broad range of topics and so important for us to learn from you and your experience. We do have time for a couple of questions. The first one comes from a patient who had a mastectomy several years ago and did not realize that there were alternative treatment options post-surgery. And so if someone were to run across that issue today, how do you recommend they approach that with their team? Does the patient need to be equipped with that knowledge ahead of time, or do you find that more teams are sharing that information?
Well, unfortunately, in Los Angeles, there are not that many cancer centers which will provide you with that help. Most of my patients come from word of mouth or referred by physicians. Of course, there are places like Johns Hopkins and places in Baltimore and places in Farber Integrative. A lot of cancer centers will have integrative medicine departments when they will do all of the above things. A lot of, like, I believe in Tower Hematology Oncology, they do recommend at least diet and at least body-mind consulting and at least biofeedback. Right now, they're building a huge integrative medicine department in St. John's Hospital. I was helping them. I was helping Cedars for many years to do it. So, yeah, it's either referral from your physician, if your physician open-minded, because some doctors still don't believe in it, because not because of lack of clinical trials, it's because of lack of desire to learn something new.
Mm.
Like, I can tell you, I constantly trying to learn something new, like CBD, psychedelics, like meditation, got doctoral in Western medicine, got doctoral in Chinese medicine, because as you remember, my lecture is called Bridge Between Eastern and Western Medicine. It's basically the bridge of the knowledge which came to humankind for 3,000 years and still works. You know, something what doesn't work will not survive 3,000 years. So why not to combine it? So if patient comes to me and say, I never knew about it, can you do something for me? Of course I can. It depends on what symptoms the patient has, what side effects. Some people come to me 3 years after surgery and they have phantom pain, or if they had chemo, they will have menopause. And many doctors will not manage it at all, because they say, oh, you can't have estrogen and progesterone. But there are a lot of Chinese herbs which will completely take care of it. And there are a lot of special treatments which will help with that.
Yeah, thank you for that. Someone is asking, after an after surgery soup, for those who are vegan, what do you recommend for someone who's vegan?
For somebody who is vegan, I would say you need a soup with a lot of proteins which are based in vegetables. I love beans, all kind of the beans, because if you look at the bean, it reminds you a shape of a kidney. In Chinese medicine, kidney is your essence. It's kind of your power. So kidney, beans, any kind of beans, soups. What else from the vegan world has a lot of protein? Quinoa. You can have a lot of quinoa. Quinoa and rice in combination gives you a full protein, basically. If you combine those two, basically anything with protein, any fruit and there are not many, there are no fruits with protein, but nuts have a lot of protein. Mung beans, I love mung beans for protein content. So lentil will have protein. So I would recommend soups with that, and mushrooms. Mushrooms have a lot of protein.
Well, there are a few more questions, but we really have reached the end of our time. And so I'm going to invite individuals who did not have your questions answered today. You can do a couple of things. We've put in the chat Dr. Lucy's email. You can email her. You can also reach out to us, and I'm going to ask Abby to share our closing slide. We'll also put the CSCLA email up there, and we can also get those questions to Dr. Lucy as well. But if you have any questions, please email Dr. Lucy or us at info@cancersupportla.org. And the class on the right is a mindfulness as medicine. It's one of the many wonderful online classes we have at Cancer Support Community Los Angeles, and we invite you to scan that code to register and join us for that class. I really want to say thank you to Dr. Lucy Postolov for spending this time with us, for this excellent talk, providing all the detailed information you did from your experience these many years. So thank you. And I want to thank you, our attendees, for joining us today, for asking so many thoughtful questions. And we hope you will join us at a future webinar. And take care, everyone, and have a great afternoon. Bye.